Hi there, I'm Brittany, one of the nurses here on our ortho trauma unit. I'm part of the team that's going to be taking care of you after you have your surgery. On the ortho unit, you get to work with several different members of our team that all take care of the patients that come through our International Center for Hip Preservation. We're going to work hard, and we're going to have fun while you're here. The nurses are going to be front line with you, kind of working with you for your pain and just getting you back up and moving. We're also going to be working with your CNAs who will be helping us getting you taken care of while you're here during your stay. And then you'll also get to meet several therapists that are going to get you back to working with your new joint the way that you should be after you get to go home. Thankfully, with our team, we have a very young team, lots of new nurses who have worked very specifically with these types of surgeries. So they get the opportunity to work with people who are similar to their age, and they're going to take great care of you. They're very interested in where you're coming from and what your goals are moving forward. Unfortunately, this is a very major surgery, and because of that, there is real pain that goes along with that. While it might be your first surgery, it is not ours, and we do handpick specific nurses to take care of these types of post-op patients, and that is because we have seen that they have an extra piece of that caring moment that it takes sometimes to get you through that pain. So this is your bed where you're going to be spending a lot of your stay. We will be getting you up to chairs and things like that to eat your meals, but we're mostly going to be spending a lot of time in the bed. This is where you'll get to use your CPM and get to do some of your therapy even to get you back to learning how to move with the new joint. One of the things that we always like to make key here is your call light. The call light is going to take care of the TV, which is great, but the most important piece is that it's got the red button there on there that calls straight to your nursing team, your nurse, your CNA, and it does ring to the front desk as well so that you are always being supported. So this is your whiteboard. It's going to be a huge asset to you while you're here. It's going to list your full care team, your nurse, the CNA that's working with them or tech, and as well as whichever nurse leader we have, because the nurse leaders are here 24 hours a day just in case. It's going to list your physical and occupational therapists that are working with you as well as listing the medications that you are taking and the next time that they're available to help with that pain. It's a nice resource that we will come in and update every shift. So twice a day, your two nurses will come in together and take care of the whiteboard to keep you in the loop for your whole hospitalization. Those nurses, CNAs, and physical therapists are all very aware of the pain that you're going to be experiencing after a very major surgery. Your nurse is going to be working the closest with the doctors as far as controlling that pain moving forward. We have different apparatuses that we use, like an ambit that's going to help kind of numb the area to help with your pain, as well as medications and things like that. We have an unlimited supply of ice to help you keep that pain under control as well. So your first night up here with us, you will have a block still on board after surgery. However, they'll all vary in the amount of time that they last. We will start you on some pain medication to try and keep that at bay as best we can. We do have to balance the dizziness that comes with a low blood pressure after surgery and then the pain medication that is safe to take care of that pain after surgery. Once you're cleared with therapy, your doctor and potentially the hospitalist that's following you, then we'll start to work things out after a couple of days typically and get you home and back to doing what you were doing before you came to see us. We absolutely encourage the parents to be here. They can be a very calming presence in the moment when the patient is having a lot of pain and the nurse has done everything, but sometimes you just need your mom or your dad or your guardian or whoever you trust to be there with you to help calm things down as well. So another benefit of our hospital is that we do have a futon in every room. This gives the parents an opportunity to stay here with their child or with their patient and help take care of them. They're able to stay here overnight much more comfortably because we do provide the futon in every room. As a parent, it can be very difficult to see this type of pain, and because of that, we very much encourage you to be here with your child. And understanding that their nurses all have their best interest at heart. So they will bring you in on the care team, but at the end of the day, they are going to be very focused on the actual patient, feeling them out, wanting to know what their experience is, and trying to help the parents get through that difficulty of watching your child in pain at the same time. The pain that we are removing moving forward, preventing more surgeries after, should be the benefit of this temporary pain that we're dealing with now. you.